My name is Jasmine Randall. I've been with TenCare for a year and 7 months, and I am the new Deputy Director of Behavioral Health Operations. No one day looks the same, and so I really like being able to interact with the providers. I'm also interacting with the managed care organizations. At the same time, I'm interacting internally, and it's just, to me, it's a lot of flexibility, and I really like that.
And my name is Meredith. I am the state lead for the Patient-Centered Medical Home Program, PCMH. I've been with TenCare for about 2.5 years, and my role is also similar to Jasmine's role, but for PCMH. Coming in, I really didn't know what the role entails, and as it's grown over time, I also realized that I've had the opportunity to steer the direction of just my growth here in TenCare, and that's been really great to just have that autonomy and power. There is no real average day for us. There's always, you have your to-do list, you come in, and then 2 minutes you're sitting at your desk, it's gone. So we really have learned how to be very flexible and nimble, and that's kind of the the nature of innovative work. You don't always have the guidelines or the manuals or know exactly what's going to happen, but you kind of just take everything head on and try to navigate as best as possible.
And we really do try to keep that balance. You wear a lot of hats in our position. You have some administrative tasks that you have to accomplish. We also oversee the managed care organizations. We interact with the providers, and so it's so important that you maintain that balance.
One of our work products is communication. We have to be very clear in our communication to one another, to our providers, to the MCOs, and I think that is definitely a very important ingredient when you're having healthy work relationships.
Yeah, I think our program really emphasizes the need to get out of the silos that we've typically operated in the past. Medical staying in their lane, behavioral health staying in theirs. Our program incentivizes that care coordination, and one of the ways that we work on integration between our programs is by having quality metrics that are shared. So our programs have overlapping quality metrics, and that kind of forces the provider to work together with their counterpart in medical to try and provide that whole person care to the members.
Obviously, as we've worked closely together and had to battle some things together, you do really develop a strong bond, and you do develop an understanding of one another so much that you can be sitting in the room, they don't have to say anything, and you already know what they're thinking. And so, honestly, a lot of the reasons why, even just outside of us, our partnerships with the MCOs, with our vendors have been very successful, is that we do recognize the value of those interpersonal relationships.
Just when you hear those stories, not only of the providers who get in, are meeting their metrics, of the members. We are able to hear stories about members who come in and they're unstable medically, they're unstable physically, and they get into one of our programs and they get that coordination, they're getting employment, they're becoming sober, clean and sober, getting treatment, and overall just becoming healthier and making a complete 180. It's all worth it, and it all really makes a difference.
Yeah, I think that in itself is why we've invested so much in both of these programs. Not just us, but the state. It's so important for us to really think about how do we truly create integrated care for our members, and that's the reason why we've invested so much in these programs. And so I think that's kind of the overarching point we would love to just share.